Hello, everybody. I am Becca Rose. I will be your host today for our webinar, which is titled Beyond the Exercises, the Truth About Myofunctional Therapy. So just a little bit of information about me. Again, my name is Becca. I am the owner and the primary myofunctional therapist here at Wisconsin Myo. And I really wanted to start putting together some of these webinar series to work as a way to give you information and answer your questions. So thank you for being with us today. And I hope that you find this information to be valuable and worth your time to watch today's webinar. So give me a moment here. I'm going to share my screen because I'll also have some slides to go through. All right, and let me make that a little bit more presentable here. Thank you for your patience. There we go. Okay, so yes, beyond the exercises, the truth about myofunctional therapy. So this is intended to be a parent, educational, informational webinar. I do have to talk about the fine print a little bit. So with everything that we see in here, I just want you to know that everything that we talk about today is my opinion. We are talking about generalizations of what orofacial myofunctional therapy is so that you have a better understanding of what it is that we do and what myofunctional therapy entails. I am super, super passionate about this. If you know me or we have ever talked, you know how passionate I am about myofunctional therapy. But also please keep in mind that everything here is educational, it's informational. It's not intended to be medical advice. Every person is so unique. So if you have any specific concerns about your quality of breathing or your general health, please connect with your primary physician, your healthcare provider, and then for anything very specific to myofunctional therapy in general, that's where then you and I can connect after the fact and talk about your specific case. So, all right, now that the housekeeping is out of the way, let's dive in. I don't want to bore you guys to death right off the bat here, but it's really important to understand what myofunctional therapy is, and that's the topic of this webinar. So I'm going to use a big word, and that big word is neuromuscular therapy or neuromuscular re-education. So the re-education part is really what we are doing. So neuromuscular re-education is a fancy way of saying that we are creating new muscle memory, okay? So it's important to know that when you're doing therapy, we're not just building strong muscles. We're not just building a super strong tongue. That's part of it, but that's not what we're doing. We are literally creating pathways. We're changing the way that the brain and the nerves communicate with the muscles that are in our mouth, in our tongue, in our throat. We are literally giving your body, we aren't doing it, it's your body is having the opportunity to rewire involuntary reflexes, like things like how you breathe and how you swallow and how your tongue moves. We are changing or allowing the pathways for those changes to happen, for those neurosensory pathways to be established. And by doing all this, recreate new automatic behaviors. Okay, so now that all the technical stuff is out of the way, we'll talk about that in a little bit of a more understandable way. All right, so why do people pursue myofunctional therapy? What brings them to our office? Well, we are under the umbrella of what's considered to be the field of airway health. So airway health is more than just about how our lungs breathe or are we out of breath when we go upstairs. Airway starts literally with our nose. So our airway is here, it goes through our mouth and then through the whole body. And then when we think about general breathing and airway, we understand what that means as far as like lung capacity and breathing quality and things like that. But we really need to make sure that you can breathe predictably and comfortably out of your nose 24/7, day and night. This is really important because obviously we need oxygen to survive, but there's other things happening with our airway and our nasal airway specifically, revolving around different breathing gases like carbon dioxide, and a little bit of a lesser known breathing gas is called nitric oxide. Okay, so that's really important for like bacteria control and viral control in our nose, and like how prone are we to get sick and things like that. So airway health is it is what we're doing here. Okay, that's what part of what myofunctional therapy is. Other people come because they're looking for dental stability. So maybe they have had braces when they were a child or even as an adult, and after some time they see their teeth start to shift again. Their teeth start rotating out of place. Most of the time we're taught that that happens because we didn't wear our retainer for our whole entire life. And although the retainer is a really important component of not restoring, maintaining your orthodontic outcome, it's not the only picture. It's only a small part of the big picture. So we have to take into consideration, what are your muscles doing? What is your tongue doing? And is that impacting how your teeth move and shift over time? I'll just say real quick, your tongue, the pressure of your tongue is stronger than even the orthodontic wires and brackets that are on your teeth. And there have been times where people have come while they're to myofunctional therapy, while they're actively in ortho, and the orthodontist says, I just can't close the teeth because their tongue is not letting us do that. So the pressure of how you swallow thousands of times a day and night, has a cumulative effect. That constant pressure will start to push teeth and change the teeth and how they fit together. So we really, really want to address that part so that you can maintain your orthodontics for a lifetime. The other part of the dental component that people come here for is maybe maybe their child has just tons of cavities, they're mouth breathing all the time. And when that happens, that mouth breathing, it changes the bacteria in our mouth, and it allows the bacteria that cause cavities to really amp up and do more damage. So oftentimes my child or I myself, I'm mouth breathing all the time. My child's mouth breathing all the time. We constantly have cavities. Is there anything else we can do about this? Yes. Airway, muscle function, how your mouth closes are all part of the big picture of myofunctional therapy. And really, I mean, we are allowing people to improve the quality of their life. Sleep improves, quality of sleep, dreaming, headaches, overall just recovery and sleep benefits improve significantly. And sometimes that's why people come here. They're snoring, they sleep like crap, they need, they're just not well rested, and they've tried all the other things. They're like, all right, well, let's try this. Let's actually work on these muscles that keep our airway open and see what happens. Okay, so we're going to talk about some of the symptoms that are in childhood. I want you guys to know that I don't work with babies. There's a very specific group of professionals that work with babies and oral function, myofunctional therapy, if you want to call it that. It's not quite the same thing. So if you have questions about where do I talk to a professional specifically about my baby, reach out to our office and we will connect with you and have those conversations. We don't charge you for that. That's just something we do. We want to be able to guide you to the right professionals for your babies. And there's lots of them out there. So we can talk one-on-one about that. But oftentimes the problems or the symptoms that we see in toddlerhood, childhood, they sometimes begin in infancy, and you start to notice some of these things in your baby. Okay. But we're going to talk more just about the toddler groups and the early childhood symptoms. So when parents contact our office and they have concerns about their child, some of the red flags that we see or that the parent sees is that they're snoring, their mouth is wide open when they're sleeping at night, they're restless, perhaps they're still bedwetting beyond like potty training years. or even during the day, they're mouth breathing, their lips are apart all the time. Perhaps they have really picky eating habits, or they're gagging on different food textures. ADHD type of behaviors, or poor focus, or just lack of focus, right? Some parents will notice that their child has really crowded teeth, or maybe their palate or their upper jaw is just really skinny and narrow inside of their mouth. Those are often the most common things that parents see in their child. I do want to make a quick note about gagging in particular, or picky eating. There are sensory components to this, but there's also a very, very big correlation between picky eating and excessive gag reflex, and airway dysfunction. So the way we breathe can actually make our airway more sensitive. It puts our body in fight or flight, and then that can really increase our gag reflex. So if there's excessive gagging, whether you're a child or an adult, whether you're eating or not, whether you're brushing your teeth, you're at your dentist office, regardless of what it is that's triggering that gag reflex, if it is super severe or super sensitive, there is a breathing component to that. So sometimes we see people come here just because they want help with their gag reflex, okay? And then the other thing I want to make note of is the attention behaviors, the ADHD type of scenarios, because oftentimes, not always, so it's important to know that, but oftentimes if a child is not sleeping well and they're sleep deprived and they're exhausted, the symptoms of sleep disordered breathing or poor sleep quality and the symptoms of ADHD are pretty much identical. So if you have this situation with your child or within your family, I would highly encourage you to speak with your pediatrician, possibly arrange a sleep study or a sleep screening to rule out that there isn't significant breathing disruption happening at night, because sometimes children are being treated with some pretty hefty medication for ADHD. And if we can rule out that it's not poor sleep, then we don't always need to take that road. I know me as an adult, when I don't sleep well, I am cranky as heck, right? But I'm an adult and I know how to regulate myself and conduct myself. Children don't always know how to do that just yet. So if you're seeing that, highly encourage that you rule out any kind of sleep disrupted breathing at night and see if that starts to improve the symptoms. Okay, so I spent a little more time on that than I intended, but it's a really important thing, and we will talk about that during an initial evaluation when you come to our office for the first time. Let's make sure their breathing is okay at night and before we go down that ADHD road. And sometimes it is really ADHD. It is a real thing. But let's make sure we understand the whole picture, okay? Just FYI. All right. So then when we have symptoms in childhood, we often tend to see those symptoms change or morph into adulthood. They become other things, and sometimes they just become worse versions of what we dealt with when we were kids. So the most common adulthood symptoms that we see come in the sense of sleep. So sleep is really kind of a common denominator across the board, whether you're an infant, a baby, or a child, an adult. Sleep quality is often compromised, or we may be little snorers when we are younger, and we just have that little bit of audible breathing when we're sleeping. Sleeping should be quiet. Breathing should be quiet when we're sleeping. But then maybe we turn into adults that are just, showing signs of sleep apnea, or our sleep quality is just getting worse. Or maybe we notice, oh my gosh, my jaw, it's always clicking, it's always popping. I feel like I'm grinding and clenching my teeth. I need a night guard. That kind of connects to everything in our neck and our shoulders. So we could see an increase in shoulder tension and neck pain. We'll often see little scallops along the borders of the tongue. And that will also tell us that maybe the tongue doesn't have enough room to actually live inside the mouth. And those scallops, and if you look at your tongue, you'll just see those little like fish scales or scallops along the side of the tongue. That's kind of a red flag in adult for having airway dysfunction or muscle dysfunction or not enough room for their tongue in their mouth. And then if you're just having constant brain fog and daytime exhaustion, that's another red flag that maybe we're not breathing as well as we should be. We're not sleeping as well as we should be. But that's a tricky one too, though, is like brain fog and exhaustion. I mean, there's hormonal components to that as well. So we want to try to put the whole picture together, connect all the dots. All right, so we talk a lot in myofunctional therapy about tongue posture. Where's your tongue? We want to make sure that it rests where it's supposed to, because the tongue in childhood, the tongue works as the natural expander, if you will, okay? The tongue should always live up in the roof of the mouth against the top of the mouth. It should stay within the side of the teeth up here. And when we're young, that tongue is what helps to grow the upper jaw and grow the airways. So the tongue is a group of 16 muscles, and it's the strongest muscular structure in our face. And when it has that correct positioning, again, it's going to help to create almost like the guiding blocks and the scaffolding to grow our craniofacial structure. That also helps with teeth eruption and allowing the teeth to kind of naturally go into the correct spots and allow them to touch together. We call that occlusion, but allow the teeth to touch together in the most ideal way. But the tongue posture on the roof of the mouth, it also pulls the base of the tongue out of the throat. And we want that to happen. We don't want the tongue in the throat or going backwards, because that is part of what obstructs our airway and can lead to some of those things like snoring, grinding of teeth at night, and even bedwetting in children. When that tongue falls back, it cuts off our air supply. Our brain goes into panic mode. It goes into fight or flight. All these micro arousals happen during the night, and something happens. We're either very restless, our bed looks like we went through a tornado, we're wetting the bed, we're grinding our teeth, we're clenching our teeth, we're snoring. Those are all things that happen when we don't get enough oxygen to our brain at night. Our brain has to do something to snap us out of it, get the tongue out of the way so that we can breathe while we're sleeping. And then again, that tongue, if it tends to live lower in the mouth, it's not going to grow that upper jaw. And if we don't grow the upper jaw, the lower jaw tends to kind of go back. It pulls backwards or recesses. And oftentimes we'll see that profile in people who just have chronic mouth breathing and low tongue support. All right, so here's just a quick checklist that sometimes it's helpful to look at to assess some of your symptoms and maybe what may be a root cause to some of those. All right, so if we're looking at breathing, okay, you might notice your mouth is dry, you have chronic congestion, allergy problems, or maybe your breathing is a little bit noisy. Even at rest, when we're not sleeping, we should never hear the person next to us talking, or breathing. So sometimes you'll see this with like messy or really loud breathing eaters. Sometimes people are like, it drives me crazy. Your mouth is open and we're just breathing and chewing. And that's a person who can't breathe well. So they have to open their mouth to help them breathe. So that will often happen if we don't have good nasal breathing. Okay, so nasal breathing is like it is the first goal that we need to make sure we can check off in myofunctional therapy. And then sleep. Okay, what's happening? Are we grinding? Are we restless? Are we tossing and turning? Again, we talked about bedwetting and other type of symptoms. Are we sweating to death all night long? And that doesn't have to do with like hormonal changes. That could be airway struggle during your deep sleep stages, and then you're constantly getting kicked out of deep sleep. You start again in stage 1. We never get to those restoration stages, and we are just chronically exhausted, or we're kids who are just chronically unfocused and cranky because we're not getting deep restorative sleep. All right, eating. I talked about eating and like that breathing with the eating, but we may also see that come up as messy eating or difficulty swallowing pills, or maybe we're adults now who always did okay with swallowing pills, but now we're getting a little bit older and we're finding swallowing pills to get more challenging, or we need more water than we used to, or we are just saliva and water just going down the wrong pipe more often than it used to. There's also there's often a tongue component to that, or improper swallow. Not just these things, but also as we get older, all of the muscles in our body tend to lose muscle tone, and that includes the muscles in our tongue, in our throat, that help us with swallowing. So if you're noticing that, that could be a red flag as well. And then posture. So we live in a world now where we are all looking forward. We're looking at devices all the time. So that really doesn't help our case. But when we look at overall body posture, we want to make sure that the tongue is doing its job up in the roof of the mouth, like we talked about, because that whole tongue is connected all through here. And if our mouth is open and it pulls our jaw back over time, our head starts to come more forward. We start to come more forward because every time we come forward, we open our airway a little bit. And then as we have to keep doing that, we get more and more forward. So there's a lot of connection between overall body posture and what is the posture, resting posture of our oral facial muscles. Okay, so we're going to switch gears here for a moment, because if you're here today and you're watching this, you most likely have heard of myofunctional therapy in some capacity. We know it's not super mainstream. A lot of people don't know what this is. But if you're here, I'm assuming that you've at least heard this term before and something piqued your interest to learn more about it today. I want to talk about some of the dangers, if you will, with social media and the way that myofunctional therapy is portrayed to the public. So you have the influencers, you have the trends, you have mewing, if you've ever heard of that, you have face yoga, you have all these videos all over the internet that are teaching you how to do things with your tongue and your face. And now they're great because they are going to do something, but I really, really feel like it's important to let you guys know that strong muscles are not the same as functional muscles. So when you see these exercises online or on YouTube, they are only addressing the strength component. And when you see certain products that are supposed to help with snoring and strengthening your tongue, they do that, but they're not addressing the function. So the most common analogy I like to use is if you are a bodybuilder, okay? If you're a bodybuilder, you can have the strongest muscles in the world. You can flip over cars and you can pull someone out of a building, but you can't scratch your back or you can't tie your shoes because you just have so much muscle mass that you can't actually do functions, right? So it's kind of the same thing with the tongue and the mouth and myofunctional therapy. It does not matter how strong your muscles are. If you don't teach them to function the way they're supposed to, guess what? You're still going to have symptoms. The things that brought you here or brought you to myofunctional therapy are still going to exist because you did not address the muscle function. Strong muscles and functional muscles are not the same thing. So that's where we're getting at, where we're talking about the trendy online things versus actual therapy. And if you remember all the way back to slide 1, when we talked about neuromuscular re-education, that's the function. And if you are not getting to that point and you're working with a myofunctional therapist and that's not your end goal, I'm sorry to say you're probably wasting your money, because you can get all the free strengthening exercises you want from YouTube. But that's not going to change your symptoms. So I could talk about this all day long, because nothing is more discouraging when people come to our office and they're like, I did this, I saw this person, and it just was nothing like what you're doing here. Because, and then it's understood that they weren't getting to the end goal of what actually myofunctional therapy is. So please do not be fooled. Do not waste your money. on online things that you can't really investigate or verify. You have to make sure you're doing it right. I'm getting ahead of myself because we're going to talk about that in a minute, but real therapy involves individual assessment and individual evaluation, understanding all of your symptoms as a whole, even from the day you were born. And if we do our myofunctional, or, myofunctional DYI, you then have the risk of creating more muscle dysfunction. You can make your TMJ or your jaw pain worse. And it's really not addressing any kind of like jaw structural issues, or things like tongue tie can be considered a structural issue. You're not being evaluated that way. So if you miss those pieces, you're not looking at the whole picture. Okay. So just keep that in mind. It's great, but it's not realistic to follow the trends online. And so kind of leading into that, I wanted to talk about this a little bit about, you see this company online, you hear about this place, you hear about this person, maybe they're a local person. But I encourage you that regardless of who you're working with, what kind of doctor or dentist or chiropractor or massage, whoever it is that you're seeing, I encourage you to do your research and learn about what exactly they're doing for you. What are you paying them to do? Regardless of what kind of modality you are choosing, you are making a significant investment in your health, in your future. It's not just about right now. It's about, what does this do for me in the long run? What does this do for me in the future? So when I say that because in 5 years of helping people with their myofunctional dysfunction in their symptoms, I hear the same story over and over and over again. And that story is, we went here, we saw this online, we did this program, and we did not get resolution of our symptoms. So I encourage you, regardless, do your research, understand that qualifications matter, training matters, certifications matter, collaboration matters. Does your provider have a network of other professionals, whether they're airway dentists or orthodontics or chiropractors or body workers or tongue tie release providers? Does your person that you're working with for myofunctional therapy have that network of people that they can connect you with? And oftentimes we end up working together with those other people on your behalf. You don't see that in the background, but outside of your appointments, they should be connecting with your provider so that you can try to collaborate the care and make the care as individually relatable to your situation as possible. So this is a really, really big thing, okay? And you can find virtual myofunctional therapy practices. They exist all over the world where they don't have an in-person option. You can see them online. And that doesn't mean that's a bad thing, okay? Because there's myofunctional therapists all over the world that are highly, highly trained. They have the highest level of certification that exists, which is also what we have here, and they can still connect you. So maybe say you see someone that is in California and you live in Wisconsin. That person, even though they live in California, should be able to have a network of people that they can connect with and help you find providers in Wisconsin that can help you. So really, really vet whoever you work with and make sure you are getting the absolute most out of the time and energy and finances that you are investing into this program and this process. So with that said, location is no barrier. I just talked about, you could see someone in California. I see clients all over the country and all over the state of Wisconsin. So really, because this therapy is not hands-on, you don't need to be in person unless you choose to. So we have options where we have our main office here in Oostburg, Wisconsin, which is just south of Sheboygan. And then we also have an office up in De Pere, which is just outside of Green Bay. And we go to Appleton once a month as well. We're inside of a chiropractic office in Appleton. So we work really hard here to make sure that we can have as much availability for our clients, whether they choose in person or virtual. Because as time goes on, there's more of a demand for in-person care. But with that said, we can see you everywhere. It does not matter where you live or what country you're in or what state you're in. And we have seen clients in all of those areas of the world. We utilize a HIPAA secure video platform. Everything is effective and convenient. We try to make your therapy super family friendly and adapt to you individually. We are also a statewide CLTS provider. So not everyone is going to know what that means, but CLTS stands for Children's Long-Term Support Waiver. So there are children in Wisconsin who have disabilities such as autism, Down syndrome, and so many more disabilities, and they have they have a program for them that allows them to see different types of therapies. They could be doing like water therapy and swimming. They could be doing therapy with art or horses and myofunctional therapy as well. So we are approved throughout the state. So if you know a child who has this program, we are an approved provider. I will say that this is not the same as Badger Care. It's not the same as Forward Health. So this is a very specific program. Families who have this will already know that they have it, or if they qualify for it. So again, we can see them statewide. Really, we're trying to improve the quality of their life, just like we do with everyone else. We want their sleep to be good, their airway to be healthy. And it allows them to be able to do some therapy at home without having to keep going to all these different offices all the time. All right, so how do we get there? What is the path to the end goal? What is the path to success? So myofunctional therapy is about time and repetition. We need time for exercises to work because that's where that neuromuscular piece is. It takes time for new neural pathways to be developed, okay? So really, we're evaluating. The first thing we're going to do is evaluate you. We're going to find out, okay, is the oral muscles contributing to some of the root cause of your symptoms? We're going to educate. We have to re-educate to form those new neurological pathways, and we have to habituate. So once you have that integration, once that happens, you then habituate and you do these things automatically all day and night. And essentially what that means is that once you have that new muscle memory, guess what? You're going to be doing a myofunctional therapy or maintaining your myofunctional therapy for the rest of your life. So that's another component of neuromuscular re-education. Once it's established, it happens automatically. And this is not the type of therapy that works for 6 months and then you stop and it doesn't work anymore. As you reintegrate these habits, they become new and you will continue to support your airway therapy for the rest of your life. All right. So what happens next? We offer a free consultation call to every single person that connects with our office. Our office manager will talk to you. We sometimes call this a discovery call. You can schedule that online through our website as well. We're going to educate you. We're going to ask you questions. We're going to allow you to know, like, hey, what can we do to help you? And sometimes we can't help you. And we'll tell you that too. If we feel like you might be better suited to start with a different provider or maybe a certain kind of doctor first, we will absolutely guide you through that process. And same thing with your baby, like we talked about in the beginning. If you have questions about your baby and you don't know where to start, call us. Even though we don't work with babies, we will help find someone that connect you with, okay? We will never, ever, 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 ever pressure you. We are here for you. Everything we do is about you. We work for you, okay? So we will never pressure you. There's never a guilt trip. You're never obligated to do anything you're not comfortable with. And we work as a team. So it's always about you. All right, I'm going to skip back here for a second because let me go back here. Oh my gosh, why can't I go back? I wanted to ask, so initially this was going to be a live webinar, but unfortunately I got sick, really sick. And so I had to do it this way instead. But I did encourage all the registrants to email us with questions so that we could answer some of those questions during the webinar today. And probably the two most common questions that came in were questions about tongue ties. So people wanted to know, hey, what about my tongue tie? I've mentioned it to my doctor, I've mentioned it to my dentist, and they all say, no, no, no. Good news, we actually, our next webinar is scheduled already, and that's going to be the next topic is tongue ties, the different kinds of tongue ties, and what they mean. So tongue ties are not just about babies, they're about kids and adults as well. I had my tongue tie released 2 years ago. So we'll talk a little bit more about tongue ties on Wednesday, May 27th at 5 o'clock. The QR code is here, or you can register. We're going to be putting that out on the socials, so you can register that way as well. And then the other questions that came in, and I think I kind of answered this already, was how do you know there's so many options online for myofunctional therapists? So how do you really know if they're really qualified? And that was a really good question. And I'm really glad that someone asked that. So when you're talking with a myofunctional therapist, they should be able to answer questions about like certain muscles, like this muscle does this or this muscle does this. And you may not care about that specifically, getting into all that detail, but they should be able to answer that. If there's a lot of, if it doesn't seem like there's confidence in the answer, it's likely that maybe they're not quite as experienced as you probably deserve, okay? So I would ask very specific questions about, my child is this, 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 this. How is this going to help them? And just really just listening to people and how they respond, usually gives us like our spidey senses start to tingle when we know if someone is really being legit, or if they're just trying to come up with an answer on the spot. Usually your gut will tell you that. So although I'm not really specifically answering the question on how do you know about their experience, your gut is always going to be first and foremost. And then from there, you can ask them, hey, what myofunctional classes did you take? How many have you taken? Over how long of a period of time? What kind of certifications do you have? Do you continue your education, or have you been doing the same thing for the last 10 years? So those are questions that you can ask as well. And some people even want to have client testimonials, something like if you're going to hire a babysitter to watch your kids and you're asking for references, some clients will actually ask for references from real clients. So if your myofunctional therapist is hesitant to supply those type of things as well, it might be a little bit of a red flag, like, all right, well, how much have you done this, and how deep is your experience? So those are just some things for you to watch for when you are looking for, whether it's a myofunctional therapist or chiropractor or a dentist or whoever it is. Ask the questions. Don't be afraid. Don't be embarrassed, because a highly trained, reputable company is not going to feel offended by you asking those questions. They'll actually probably be honored that you ask those questions. So keep those in mind. Okay, here's our next webinar information. I answered the questions that came in already, and then of course we just have some references here, but I'm going to stop sharing. And I want to just take a moment to thank all of you for registering for this webinar. I hope that you got something from it. It helped to answer some questions, or at least bring some things to the forefront of your mind about some of the symptoms that you or your child may be experiencing. And we, again, encourage you to reach out to us anytime, even if we're not the ones to help you. We're going to connect you with someone who can. So thanks again for watching, and we look forward to seeing you at our next webinar that's going to talk all about the different kinds of tongue ties and how they may be impacting your symptoms. All right, everybody, have a great day.